Joy 99.7 FM.
Okay, if you can hear me, then by His grace, we're in the month of June. Ultimate Health on Joy 99.7 FM. Amen always. Joy 99.7 FM. That's right, if it impacts on your health and your well-being, we'll bring in all the top-notch practitioners and professionals and properly, duly inform and transform your life. My name is Nortey by nature. The program is Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05, we are indeed alive. Just because He made a way. My late brother Koda says so.
Joy 99.7 FM.
All right.
Joy 99.7 FM.
Standing here, not knowing how we'll get through this test. But holding on to faith, you know that nothing can catch you by surprise. You got this figured out. You watching us now. And when it looks as if we can't win, you wrap this in your arms and you step in. And everything will need you.
Joy 99.7 FM.
In control, and now we know that you made a way. When our backs were against the wall, and it looked as if it was over, you made a way. And we're standing here only because you made a way. My Jesus, you made a way.
Now we're here, looking back on where we come from.
Because of you and nothing we've done.
You deserve love and mercy you've shown, but your grace was
Joy
strong
99.7 FM.
You made a way
Sure did.
when our backs were against the wall, and it looked as if it was over. You made a way, and we're standing here only because you made
Terms and you
made a way.
when our backs were against the wall.
When our backs were against the wall,
And it looked,
and it looked as if it was over.
you Jesus, you made a way.
Made a way.
And we're standing here today.
And we're standing here only because you made
For your
a
mountains,
way.
you cause walls to fall with your power. You perform miracles. There is nothing, oh no, that's impossible. And we're standing here only because you made. Say,
You move mountains,
yes, you did, yes, you
you
did.
cause the walls to fall.
Most definitely, He moves mountains, causes walls to fall,
There
performs miracles.
is nothing
Nothing, no, no,
that's
no, no.
impossible.
One of those miracles is the fact that you are awake, you made the wake-up list,
Only because
and it's time for Ultimate Health on Joy 99.7 FM. Great stuff, great stuff. Welcome to Ultimate Health on Joy 99.7 FM. Yeah, sometimes I do get in the spirit, but that's because my heart is beating and I'm well by grace. Another edition of Ultimate Health. Last week we started looking at measuring your blood pressure accurately. We learned a lot of stuff. Some people think we talk too much. This is simple. Move on. No, we will not move on. We'll explain until we have informed and transformed you. So tell somebody that, yes, Joy 99.7 FM Ultimate Health is on with Nortey by Nature. My doctors are in the studio. Dr. Benjamin Tobo is with us. Dr. Nanekua Asante, they are cardiologists. Yes, get your heart in the right place, in the right shape. I will even ask them, should I be talking to a cardiologist? I mean, hypertension. Come on. Please, when you get to the heart, it gets a bit worrying. Docs, you're most welcome. Right. How's your week been? I can hardly hear you. How's your week been? Hectic. Oh, but I saw you chilling on Friday. I'm not allowed to say that. Doctors do let their hair down, even if they don't have hair. But you're most welcome. We're grateful that you've joined us again to, break down hypertension, right? High blood pressure. We got to understand some of the causes, some of the risk factors. And more essentially, we learned how to properly measure or take our BP. Many people think you just strap something on, you sit anyhow. We learned that caffeine and some stimulants can influence the reading, your bladder, and all those kinds of things. Any quick things you want to hit on before we start class from last week?
Well, the most important aspect concerning this has to be with encouraging every Ghanaian, as part of our hypertension awareness creation, to go and get themselves checked up. Because
know your numbers.
Our health seeking behavior is very, very, very poor.
Right. Don't just assume you are fine. Have it checked, right?
You feel fine, just confirm it.
Okay.
Then you know you are fine.
Right. And that's the reason we call it the silent killer.
Exactly.
Right. Nana Ekria, you're welcome.
Thank you.
Last week, people were worrying me. They say she's pretty. As if I bring people who are not, on the show. Me, they don't tell me I'm okay. But you're welcome.
Thank you.
All right. So yes, silent killer. Are there none at all in terms of signs and symptoms? Some people say maybe it can start affecting your vision. If you get headaches, it could be your BP. Is there nothing at all? Is it totally mute, vibrate only?
So largely, yes, it is silent.
Okay.
Unless it is actually affecting certain organs in your body.
Okay.
So if it's not affected anything, usually you will not feel anything. You
But it's
feel
there.
okay, but it's there. So sometimes the moment you start feeling some symptoms, then maybe it's affected certain organs. Like if it affects the brain,
Okay.
then you start having headaches. Sometimes you may be vomiting, you feel nauseous.
Right.
If it affects the eye, you may have some blurred vision. Eventually, you may lose your sight.
Okay.
It affects the heart. You can have chest pain.
Okay.
But largely, it will not show any symptoms unless it's affected certain organs.
Okay.
On some few occasions, some people may have just headaches and then uneasiness, and then
Okay.
they'll go and check.
Right.
Then they'll think.
Would I feel dizzy? Anything like that? Would it be related or?
Oh, it can, yes. It
Right.
depends on which part of the brain is affected.
Okay.
So if it affects the vestibular system, yes, you can feel dizzy. So
Okay.
It depends.
Folks, today on Ultimate Health, obviously on Joy 99.7 FM, we're taking a look at common complications of untreated, unidentified, or poorly managed. Many of you are on treatment. Even those of you on treatment are a sad minority. We need more of you on treatment. And of those of you who are on treatment, many of you are not achieving satisfactory targets and control. Hence, you are poorly managed and the damage may still be going on. Right? So
Yeah.
today we are looking at that. We want to understand. We also want to understand certain common patterns of behavior or things you do that compromise the management that you think you are under. okay, whether you skip your doses, whether you are taking certain things alongside the medication that you shouldn't. My docs will be sharing that. If you have any questions, concerns, WhatsApp is 055 11 997, and we're live on Facebook, YouTube, and X. Okay.
Joy 99.7 FM.
So let me start by asking. Many people last week shared, some are not on medication, but they seem to be responding to the lifestyle changes, the behavioral changes, and so on for the modifiable variables. Okay, but there are a lot of people on medications. Okay, today I want to start, before we even get to the complications. How do these medications work? What are they doing that maybe, just a breakdown so that I'm taking this is what it's supposed to do, right? And in doing that, these are some of the other things I'll experience. Okay, so what are the common, should I say, classifications of antihypertensives, and what are they doing? Nana Ekria. Yeah.
Okay. So we have different kinds of the antihypertensives.
Okay.
So we have the diuretics.
Okay.
So you realize I mentioned that if you're taking a lot of salt, sometimes you're taking a lot of water, and the sodium will let you take in a lot of water, and then as the water builds up in your blood vessels, basically your blood pressure will go up.
Elevates the pressure.
Yes.
Okay.
So the diuretics will let you bring out a lot of the water out.
Okay.
So that's how that one works.
So you're bringing it out. Are you perspiring? Are you urinating?
You urinate.
So you urinate a
Yes,
lot more.
a lot more than usual.
Okay.
So that it will bring the blood pressure down. So that's one class.
Okay.
So
hang on a second. So diuretics.
Diuretics.
They stimulate the urination, the passage
Basically, yes.
of the fluids.
Yes.
Which are contributing to the elevation of your blood pressure.
Yes.
Okay.
please.
And last week we learned that this is triggered by the sodium or the salt you are taking as well.
Yes.
Okay, great. All right.
So so it makes you expel some of the sodium out as well.
Okay.
So if you are taking that, some of the side effects that you would expect is that maybe you can't bring out a lot of water, you may be a bit dehydrated. If that can be one, and then electrolytes imbalance because you are urinating a lot of the sodium out. Your sodium may be also low, so that's one of the side effects that you can get, and that's one class.
Right.
We also have another class. We have beta blockers.
Okay.
So beta in your heart,
Right.
there are some receptors there that when they are stimulated, they'll cause your heart to contract a little bit more.
Okay.
In the blood vessel, they can also make it narrower, just to raise your blood pressure up.
Okay.
So the beta blockers will go and block these receptors, such that now you would not the blood vessel will not become narrowed. So it will be relaxed, and the more relaxed your blood vessels are, your blood pressure, it can help bring the blood pressure up.
Okay.
So that's one other class.
All right.
And then we have we also have the ACE inhibitors.
Okay.
So they are angiotensin receptor inhibitors. So for them, they also work basically. So there's a part of the kidney that also helps to absorb the sodium and all that. So they also basically work to block that portion.
That reaction.
So yes. So basically that is it.
Okay.
We have calcium channel blockers.
Okay.
And then we have alpha receptors as well. Alpha receptor blockers. They too the same thing. They cause narrowing of the blood vessels. So when you block that, you make the blood vessels wider,
more relaxed.
More relaxed.
Okay.
And then
all right.
yeah.
Okay. 17 minutes past the hour, 2 on Joy 99.7 FM. We're talking about common complications of untreated, poorly managed high blood pressure, which is hypertension. Some of you last week sent me messages to say you didn't say anything about hypotension, low blood pressure. We'll stick that in today. We're taking our time deliberately. All right. If you have any questions, concerns, WhatsApp is 055 11 11 997. Okay. So what we're doing is we're trying to interrupt, right, certain processes of the body, the heart, right? The circulatory system, right? So these things that make the blood vessel narrow or the heart constrict and so on, they are normal processes. But if you have high blood pressure, we want to interfere or change or modify those processes.
Yes.
Okay.
Yes.
If you've been taking a lot of salt and therefore this has led to the elevation, now we want you to pee a bit more, urinate a bit more to as form a part of the regulation
Yes.
of your blood pressure.
Yes.
Your body normally does this by itself.
Yes.
But if you have high blood pressure, then this has kind of malfunctioned.
Yes.
Okay. All right. So we have a sense of what the medications are doing. Dr. Tobo, so I could be on several medications and therefore my doctor could be trying to harness or leverage several of these mechanisms in the management of my blood pressure. Is that so?
Yes.
Okay.
When you look at the way the blood pressure is generated,
Joy,
let's look at the
99.7
physics of it.
FM.
Okay.
Blood pressure basically is a product of what we call the total peripheral resistance. That is how much the blood vessels are resisting flow through them.
Okay.
And then the cardiac output. That is basically how the heart is generating the volumes that it is sending into those vessels,
Okay.
and at the rate that it is doing that within a minute.
Okay.
So when you look at the whole BP, it becomes equal to the resistance times the volume, then times the heart rate.
Okay.
Okay, so when you see that mathematical relationship and you want to bring the pressure down, then if you affect the volume, that is bringing the blood volume down, you help to bring the BP
How
down.
much am I pumping in the first place? If I change that, then the pressure in the pipe will also be
Will also
affected.
be affected,
Great,
exactly.
I understand that. Okay.
Yes. So, and the volume you are sending into the pipe, if you're able to control that and bring it down also, you can affect the BP.
Okay.
And then the third value, which is the resistance to the flow, which is how, like Nanika described, how the vessels become tighter and tighter and
Okay.
narrower.
All right.
If you control that one by opening the vessels up, then you are allowing the pressure to also come down. So
Okay.
we select the drug groups based on
99.7
these
FM.
factors.
Okay.
So that we're able to use it to control the blood pressure.
Okay. And we learned last week that if, of course, you are unique, you are an individual. So your combination in terms of management or intervention will differ from another person who has
Oh, yes.
hypertension.
Yes.
So your doctor may give you a different class
Yes.
or combination of medications.
Yes.
Your compliance to that management is different from what is expected from another patient.
Yes.
Exactly.
Okay, great. We understand that. WhatsApp is 055 11 11 997, right? Shortly, I will activate the phone lines. We're live on Facebook and YouTube. And always, Ziggy, my producer, does his best to filter in your Facebook and other contributions, not just the WhatsApp, right? That's why he's here, and that's why I bug him a lot. Okay, so we've understood that. When we are managing you with medications, this essentially is what we're trying to do. Okay, so if you are worried about excess urination and all that, sometimes is this explained to you by your doctor, your physician, that this medication will actually cause you to urinate a lot as part of our intervention? Is this explained? Or do you?
It should be.
It should be.
It should be. The doctor should explain it to you. The pharmacist giving you the medication should
Okay.
also let you know.
Okay.
And if you even experience something that was not mentioned to you,
Okay.
make sure you tell your doctor.
Make
And if-
sure.
Make sure you tell the doctor.
Okay.
And then they'll
All right.
explain
This is important because some of you think
99.7
that we don't need to get into the pharmacology of it, right? Sometimes you're given medication. In your experience, you think, Emamida, it makes me sleep. Do you see? But it's actually undertaking specific things. And this will lead us into the flaws. The things you do, right? We're trying now to excrete or expel sodium and excess fluid, right? And then you are taking more salt, right? So you are fighting the management, essentially.
Yes.
Okay, and we had questions about this salt relationship,
Yeah.
right? So I've given you medication to stop this, but hey, you are not modifying your diet, right?
Yeah.
So the fight is on. Okay, right. Great stuff. And somebody wanted us to talk a bit about low blood pressure. Is it a problem? Is it dangerous? We don't hear enough about hypotension or low blood pressure. Can we say a word on that?
So, low blood pressure, hypertension is basically low blood pressure.
Okay.
So, as we mentioned, the
99.7
hypertension,
FM.
the number that you need to jump that fence is 140/90.
Okay.
For hypertension, it is when it is below 90/60. So, the systolic, the one above, when it's below 90, and then the diastolic when it's below 60.
Okay.
Largely, some people have some form of chronic hypertension and they are okay. Once
Right.
your organs are getting enough blood supply, it's
Okay.
fine. But the problem is when it suddenly drops.
Okay.
So maybe for you don't usually have those blood pressures. Then something happens and it drops. When it drops, then you will have symptoms. And it becomes more dangerous when it drops to a level that, like I mentioned, vital parts of your body
Joy
does not really get
99.7
The supply.
the supply. That's when you would have the symptoms and it will become dangerous. So what are some of the symptoms that you would get? Some people will feel faint, headaches,
Okay.
dizziness. Some when they get up, when you get up, your blood pressure will drop. We call that orthostatic hypotension.
Right.
And depending on whether some of the vital organs are affected, if the brain is affected, you may become very confused.
Okay.
If your kidney is affected, maybe your urine production will then be reduced.
Okay.
So it depends.
Right.
And there are things that can suddenly drop your blood pressure.
Okay.
So,
So this makes it also of concern.
yes, if
It's-
it drops suddenly,
Right.
yes,
Okay.
yes.
But you say some people have this chronic low blood pressure, and if
Yes.
all other things are fine, it's not of concern.
Yeah,
Yes.
it's like a normal distribution curve where there are people at the fringes
Okay.
who, despite being in that low blood pressure state,
Okay.
their body physiology is adjusted
Okay.
to that. So for them, it's okay.
Right.
Like me in particular, my systolics tend to hover around 94.
Hmm.
And I don't feel bothered by it. I don't feel faint or have all these symptoms that
Right.
because the brain is the most it's like the early warning system for hypotension.
Right.
Because as soon as it gets a shortage in supply,
Right.
it will send you into a position that will make you improve supply to it.
Okay.
So that's where you find yourself kissing the ground.
Hmm.
Because your blood pressure has just dropped,
Okay.
so that gravity effects are minimized, and then the brain can have its blood supply restored. Then you
Right.
see the person waking up almost instantaneously.
Okay. All right. 26 minutes past the hour of 2 on Joy 99.7 FM. The program,
Joy 99.7 FM.
as always, on a Sunday afternoon, 2 to 3 is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. I'm speaking with cardiology fellows in training. They deal with matters of the heart. Not the type you'd like, but yeah, matters of the heart. Dr. Benjamin Tobo is with Wing Commander Doctor. I saw him amongst his ranks the other day. I don't know who to salute and who not to salute, but he's with the 37 Military Hospital. And then next to him, Dr. Nanekria Asante. She's also a cardiology fellow in training, and she's with the Kolebu Teaching Hospital. Okay, if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube and X as well, and shortly I will activate the phone line so you can have a heart-to-heart conversation with my cardiologist. All right. Okay, this one says my mom used to have headaches and complain of other problems when she faced taking medication. She decided to stop for over a year now. I am worried. What are the other natural remedies without medication? We get these questions often, right? I would love to be off medication. Many people try their own subjective drug holidays. And to the extent that they feel they are fine, but this question says, are there any natural remedies to, I do believe, hypertension, high blood pressure? All right. This is from, what is the name? Malni Misma. Okay. Emmanuel Achu Agra says, could you please explain the importance of exercise for individuals with hypertension? It came up last week. Also, how much exercise can be deemed excessive? Docs. So the first one, somebody has stopped taking her medication due to certain contra or adverse effects, right? She complained about, and her daughter is asking, is there anything she should be doing which is non-pharmaceutical, non-drug, which also helps with the hypertension?
Well, okay. Go ahead.
Okay.
So basically, you have to take your medication. The medications will help.
Okay.
If you're having the side effects, like
Right.
we mentioned, I've mentioned several classes of medications.
Okay.
So you can talk to your doctor,
Right.
and it can be changed if you are having side effects to the other one.
Okay.
The thing too is we should be sure that she's elderly. I'm presuming.
Okay.
So we should be sure that we are not dropping the BP so low, because like I mentioned to you, when you have hypertension, you can have headaches and then you feel dizzy and all that. So that's one of the things that we have to do. And so that means that at home, because sometimes in the office, like in the hospital, your BP may be high, but at home when you are relaxed, it may be low. So you should ensure that you've checked your BPs at home,
Okay.
record it, and let your doctor know,
Okay.
and then tell them about the symptoms you are having will
Right.
change. What he or she can do is that they can reduce the BP medication and monitor. We also talked about the lifestyle changes, which can also help. But basically, that's it.
Okay.
So you don't stop unless your doctor has asked you to stop.
Okay.
Yeah.
Nana Kriya, and I said Nana Kriya, yes. I'm happy you brought that in. You see, when you say what you can do is to reduce, too many people, you've empowered them. Aha! What? I can reduce, modify, but you started essentially by saying this is a dialogue and a partnership between you and your physician.
doctor. Yes.
Right. Okay. Many of the people we are talking to have made some of these adjustments themselves.
You don't do that.
Okay.
You don't make that decision.
Okay.
So that's why I said you check your BP. Your responsibility will be to check your BPs at home.
Right.
Write it down, send it to your doctor. Both of you will discuss. Tell the doctor, these are the side effects I'm having. And then based on that, if he has to adjust it, he will adjust it.
Okay.
If he has to change it, he can change it, because
Okay.
I don't know, some people, especially the elderly, they are prone to having the orthostatic hypotension I
Right.
mentioned. And some drugs may cause it more than the other.
Okay.
So maybe if you are on those drugs, they can change to another one for
Okay.
you.
My
Yes.
dear, let me
But
just ask you, the orthostatic, right? You did explain it, but again, I love precision and clarity. So, is it a change in your posture which is causing the symptoms? Let's break it down a bit for my listeners.
Okay. So it's basically when you rise from either lying on a sitting position and then you stand up.
Okay.
Gravity will pull the blood down, like
Okay.
we mentioned. So when it comes like that, the brain will not have enough blood supply.
Okay.
Then you start having some symptoms. You start feeling dizzy, as if you are lightheaded, as if you are about to fall.
Okay.
And in the elderly, they are even prone to like falling and all that.
Okay.
Yes. So basically that's
So you got up too abruptly, too
Abruptly,
suddenly.
yes,
And then
and
your
then-
body has to adjust.
Yes,
Right.
because your BP suddenly drops as well.
Okay.
Yes.
Orthostatic.
Hypertension.
Hypotension.
Yes.
All right, class stand. I'll check that in a bit, and I've got my cane soaked in kerosene as well for those who don't give me the answers. Okay, 055 11 11 997 Ultimate Health on Joy 99.7 FM. We're live on Facebook, YouTube, and X. Get in on this very, very, very important, indeed non-negotiable discussion. Education, information, and indeed transformation. We're talking about the things that will happen if you don't manage your high blood pressure and indeed your blood pressure well, right? I've got cardiologists in the studio. Okay, my heart people, are you the ones I should be talking to? Somebody not seeing a cardiologist, right? Let's narrow it down. If it's been identified, of course, every physician should be able to identify this. Should you be seeing a heart specialist? Though we can see the relationship. Are you the ones we should be seeing cardiologists?
Well, it depends on the degree of severity of the problem.
Okay.
Because usually, because of how prevalent heart-related problems are,
Joy.
the simpler
99.7
ones
FM.
are usually allowed to be managed at the primary physician level.
Okay.
So that you don't burden the cardiologist with all cardiac problems.
Okay.
Because then that makes the work a bit difficult, and then you're not able to have adequate time to individualize the care
Okay.
to those who have much more severe problems. So the primary care physicians are able to efficiently manage patients with simple problems, so that those that are beyond them, they
Okay.
refer to the cardiologist.
All right. Okay, Ziggy, we'll need a heart specialist for our WhatsApp. We just started. Wow. All right. Oyena Fienya says, hi, good afternoon, Nortey. How are you and your doctors? The laughing doctor. Oh, this is Hayford there. Was it from last week? He said the way you laugh reminds him of a teacher of his or something, right? What's his question today? I want to know if someone who has BP and arthritis, can the arthritis cause the pressure to go up? The person always takes her medication. This is from Mamiefua Tantra Hill. Hang on to that one. Let me read a couple more. Wow. This one says, let me see. I've read that one. Okay. Next one. Up. Let me come from the top. Good afternoon, please. I'm diabetic and also hypertensive, and my problem is the swelling of my feet. The swelling comes when I go to work, and when I'm home, it doesn't when I'm home. The swelling becomes so tender that when I press the finger, it enters, right? So when, they touch the feet. Is it the sugar or the BP that causes this swelling of my feet? Okay. There's no name there. All right. Let me see if I can do a few more. Hello, Nortey. Big thanks to you and the doctors. Please, I want to know how often can one check their BP, right? This is Celestina Mauto of Adafua. Thanks, Celestina. How often should I be checking? Is it too much? Have I become obsessed with checking? Can that in itself raise the BP? Wow. Okay. This one says, ooh. Good afternoon, Ziggy. You are spoiling the airways with local... Oh, okay. Where did that come from? Ziggy, your fans. All right. Okay. Can we get a few answers to this? Diabetic and hypertensive, swelling of feet, which is causing what, and so on.
Okay.
Yeah.
So, for your feet to be swollen, a lot of things can cause it. Actually, it could be. There are different things. It's just water that's accumulated in the tissues of. In the tissues, how do I put tissues? Yes, in the tissues.
In your lower limbs.
In your lower limbs,
Okay.
the tissues in the lower
Right.
limbs. So just water accumulation. So that's how come when you press. It's called pitting pedal edema in our terms.
Okay.
So that's how come when you press, it goes inside. And different things can cause that.
Okay.
It could be from the heart. It could be from the kidneys.
All right.
It could be from the liver. It could be from maybe you are not eating well, malnutrition, and so your proteins in your diet is low. That
Okay.
can also cause it. Or maybe sitting for a long time can actually also cause it. It could
Okay.
sometimes, some of the antihypertensive can also cause that.
Okay.
So there are lots of things that can cause that. He or she can talk to his her doctor,
All right.
and then they would investigate and make sure that it's none of these.
Okay.
If it's just maybe sitting, that's causing that. But then maybe when you are sitting down, you can elevate your legs, and then it will help. Like try to bring your legs up. But again, you will have to. If it's the drug too that is causing it, the drug can be changed.
Okay.
And then if it's your kidneys or all the other things, we'll have to investigate and be sure what is causing
Right.
them.
I love it when you say that, because very often you take a specific complaint, even though we're focusing on hypertension today, and you are required to run several investigations. Some people think you guys just want to rip us off. You get a percentage on the investigations or whatever, but you want to check other systems that may be related to the symptom you've reported.
Yes.
Right. Other things that could be causing the swelling of your feet.
Yes.
Okay. And if it is postural or to do with your position or posture, that could also explain why it doesn't happen that seriously or frequently at home.
Yes, because you're
But
walking around.
You're
and
walking
all
around, but in the office, you get that.
Yes.
Okay. I think the same person, there was a linkage between, the person wanted to know diabetes and hypertension, which one is causing this? Or essentially, you've already answered that.
Well, they both have a kind of very, they are bedmates.
Okay.
Yes, and diabetes will predispose you to damage,
Okay.
to your blood vessels. And the blood vessels, when they start getting damaged, they start thickening and they start narrowing.
Okay.
And like I said, using the blood pressure equation, when they narrow, then the resistance in those vessels start to go up,
Okay.
and the pressure will go up. And
Right.
if it happens in the kidneys, not only is the narrowing a problem, it triggers a system that makes the kidneys think that you don't have enough supply coming to it.
Okay.
So it will cause the body to be retaining more salt.
Okay.
And where salt goes, water follows.
Right.
And if that salt and water combination enters the bloodstream, then the volume of the blood will increase.
Okay.
So at the end of the day, your BP equation, the volume component is going up, the narrowing component is going up,
All right.
and ultimately it just drives it like a vicious cycle.
Okay.
So
Right.
they go together.
Okay, so it's not just as straightforward as one symptom, right? It could be indicative of many things that could be going wrong with you. Let me activate the phone line 030-221-6541. To be fair to those who want to use the phone line, 030-221-6541. We're still live on Facebook and YouTube. Yes, it's a lot, but that's our charter, right? So we're live on Facebook, YouTube, and X. And the phone line 030-221-6541, and WhatsApp is 055, building up rapidly, 1111997. I have a call, Ziggy. Yep, Ziggy says I have a call. I obey. Hello, good afternoon.
Good afternoon.
Yes, sir. Your name and where you're calling from, and then shoot.
My name is Chidiak.
Chidiak. All right.
Yes,
You're welcome, Chidiak.
thank you. Okay, now the understanding is that our blood vessels are the conveyance belt. Is that not it? So we can describe it as a pipeline that conveys water from the source to our homes. Okay, if that is the case, that means if the pipe holes are blocking, then you begin to have BP from the explanation. If so be the case, are we saying that we've developed up to AI, artificial intelligence? Are we saying we've not developed any means to wash these blood vessels, that the blood vessels are blocking, enough blood is not going, and people must die? I want to know.
Okay, thank you, Chidiak. Right, I was going to bring that up later, but we've already tiptoed into the complications, right, docs? Right, but you see a lot online, Google, right? Clean, unblock your veins, and many things. He's asking, at this level of advancement, is there no way I can flush my system out? And therefore, whatever formula that Dr. Tobo is sharing with us, which gives us the pressure coefficient in these vessels, in the heart, can it not be reduced? Okay, Ziggy tells me I have pressure on my phone line. Somebody's also asking about missed doses of their medications. Hang on to that. All right, hello, good afternoon.
Good afternoon.
Yes, sir. Your name and where you're calling from, and make it.
I'm B from Tehran.
All right, your question.
When you are with someone special, how high can the pressure go?
Say that again. When you're with someone special.
Yes. How high can the pressure go?
So being with someone special elevates your blood pressure. That's your hypothesis.
It's a word of wisdom.
Words of wisdom.
Yes.
All right. I'm listening for the wisdom. Is there a question, or you're saying relationships can affect BP?
Is he asking
Yeah,
how
when you are
high
with
the
someone
pressure?
special, like you are in a confinement, how high can the pressure go?
Oku. All right. I'll ask my doctors. And when you're with somebody special, how high can your BP go? We will decode that. We'll do our best. I have another caller. Hello. Good afternoon.
Yeah, good afternoon. This is Selassie from Joel.
All right, Salashi, you're welcome. Shoot.
Okay, so can taking magnesium-rich foods help with the dilation of the arteries? That's the arterial resistance.
Okay. You see why I talk plenty. My listeners don't joke. Can taking magnesium help, right, with the widening or the dilation? The words he used already tells me that, hey, Selassie, Shaye. But docs, yes, magnesium.
So basically, more of potassium-rich diet.
Okay.
Because at the kidney level, usually sodium is exchanged for potassium.
Okay.
So if you are taking a lot of potassium,
go ahead.
So sodium is exchanged for potassium. So if you are taking in a lot of potassium, then you bring out a lot of sodium. And like they said, where salt goes or sodium goes, water too goes. So you bring a lot more of the water out and reduce the blood pressure. So more of potassium.
Okay.
However, magnesium sometimes enhance the absorption of potassium as well.
Okay.
So yes, if you take that too, you
can help.
Yeah.
When you say that, okay, just tailing on that, is that, somebody will understand this. So what? I should be taking supplements with magnesium?
Or more of, like I mentioned, potassium primarily.
Okay.
And they can be found in the food that we eat, even in Ghana. Yes.
Okay.
So avocado contains a lot of potassium.
Okay.
Banana contains a lot of potassium.
Okay.
Potatoes also contains a lot of potassium. And then green leafy vegetables, so kontomire, all those ones also contain a lot of
All
potassium.
right, I have another caller. Hello, good afternoon.
Good afternoon.
Yes, sir. Who am I speaking to?
Maxwell from Kofodia.
Maxwell in Kofodia.
Yes.
Okay, I'm standing on my chair. Your question, please.
Okay. First of all, thank you for the good work you are doing. As you've done this work consistently, and we appreciate you. I want to find out, in case someone is on a big medication, and perchance he forgets to take it maybe a certain day, can the person take through the following day to balance for what he made the previous day? Thank you very much.
Okay, you forgot to add that person could be you. But yeah, so missed doses of medication. What should we do?
You just take the next dosing cycle.
You continue.
You just continue. You don't need to double the dose because you skipped a dose.
Okay.
You just take it, because the thing is, BP takes time to build up. Okay. Until you see the person. It's not like the blood pressure increase just started the day before.
Okay.
So he's already been hypertensive for a while. So when you skip a dose and you remember, just take it at the next dosing cycle and continue and be checking to confirm that your blood pressure is actually going towards the target.
Okay. Yeah. Your checking was also the subject of a question. How often should you check?
Okay, so really, it depends. Per the guidelines, if the European Society of Cardiology guidelines, if your blood pressure you checked and it's less than 120/70, and you are less than 40 years, they advocate that you check it every 3 years, once every 3 years. If you are more, that is them.
Okay.
If you are more than 40 years and your blood pressure is also, even if you are more than 40 years, then yearly. If you are less than 40 and your blood pressure was above 120/70, then you check it yearly. Now, if you are diagnosed with hypertension, then when you are checking your blood pressure, it depends. It depends on you and your doctor. But again, like I mentioned previously, if you were the last time you came, you checked your BP and was around 140, 145, 150 in hospital, because of the probability of wide code hypertension, I would not on that day say that you have hypertension.
Okay.
you would go home. You check. There are two means of checking. So the home BP monitoring. You check your BP in the morning and in the evening.
Okay.
The advocate, I check it for about 3 to 7 days, but ideally 7 days is okay. But morning and evening.
To get a profile.
Yes, so that when you come, we'll average it and see what your BPs are like.
Okay.
There's another way that they give you the ambulatory BP monitoring. So that one, there's a machine that you wear. And after every 15 to 30 minutes, it checks your BP and gives us an average.
Okay.
So that's it. So now it's been established that you have hypertension. I put you on medication. I'll let you check maybe morning in the evening as well, because there's also the masked hypertension where for that one, even in the hospital, your BPs may be normal. But when you're at home or at night, your BP may be high.
All right.
So you just check morning and evening too for that when you're diagnosed. And then based on that, maybe after 2 weeks, I'll tell you to come back because you're on medication. Look at it again. Then you check until if your BP is stabilized, then maybe every 3 months or so you can check it. Yes.
All right, I have BP on all my lines. WhatsApp everywhere is building up. Let me take this call and then try to clear the WhatsApp as well. Remember, there's a question about cleansing the veins or the arteries as well. Hello, good afternoon.
Good afternoon, Nortey.
Thank you for waiting. Who am I speaking to?
King James, Pram.
King James.
Yeah.
Pram. Please go ahead quickly.
Nortey, I've been on this hypertension drug for over 30 years now. I don't know whether I should change it or not. Amlodipine and losartan for over 30 years. And I'm thinking psychologically I have to change it. Although it's not affecting, although my BP is not affected in any way.
All right, King James. So your BP is controlled satisfactorily, right?
Yes.
Okay.
But my problem is, for that long on that drug,
You want to give your money to another company. But I understand. It's a common question, all right? I'll pass that to my guests. All right. Okay, let me try and do some quick. So, he's been on it for a long time. He's fine, all right? That's, for me, the most important thing. But changing medication, 30 years.
Well, for blood pressure, because it's not like malaria that we treat and cure. It's controlled. Yes, it's like a calabash on water. So you keep taking the medications to keep it at the target or below the target. You stop taking the medications, the blood pressure will start rising again. So that if, because he's fed up with the type of medications he's taking, he can discuss with his primary care provider. So they offer him an alternative. It's not about just changing the medications, but the aim is to target the BP to the set target. Some people, because of the medications they are taking, they may be taking it more than once a day or taking 1, 2, or 3 pills at a time. Now there are combination tablets, so that you have one tablet that has 3 different drugs in it, so that you end up taking just 1 tablet a day to make it more convenient. So if that is the problem he is having, he talks to his primary care provider. They offer the alternative. Hopefully it shouldn't mess with his BP control that he has optimized.
All right, great. Optimal control. You seem to have it, King James. Don't mess with it, all right? Don't touch that dial. You're good. And maybe that accounts for your 30 years. Because we haven't even touched some of the bigger complications, stroke, heart conditions, and so on and so on. But the traffic on my WhatsApp, right, I haven't even finished that, right, tells us that people are really into these medication issues that I chipped in. Last week, somebody sent, I think it was Ida, said that, so is there any long-term effect of being on these medications? I've been on it for a long time. Is anything happening that should not be happening? Should I be on this for so long? Isn't there a danger that something could be going wrong?
So, like Dr. Toba mentioned, is your BP is you can't cure BP, your hypertension. It can't be controlled, and it's the medications that's doing that. So yes, you can take it for life, for the rest of your life. So far as you're not having any adverse effects. Like we also mentioned, that's why it's important that you don't just maybe I give you a medication, you take it and you think your BP is controlled, so you don't go for hospital visits again. Because as you come for your regular hospital visits, we also check other things.
Okay.
We are looking at your kidneys. Are they going down? Is it and if it's going down, is it because of the medication? If it is, we can change it.
Right.
If it's going down, there are some that it gets to a certain level that you would not be put on it, so we'll have to change it.
Okay.
But largely, if you are fine, your organs are performing well, you don't need to change it. You can just continue on
All
the
right.
medication.
The crux of that is don't dump your doctor just because you have the name of the medication and you can go and keep buying and taking and
Yes.
buying and taking.
Yes.
And even the assumption on you taking, should I say, in a disciplined manner,
Yes.
should not be made by you.
No.
Your doctor will actually need to review you on a regular basis. Okay, let me see. Gosh, 53. Let me see. I have so much on my WhatsApp, but it tells me we're doing something right. Okay, even though it's building pressure. This is Iggy from Tema. What does it say? Hi, Nortey by nature. Kindly ask your guests if there's a way I can prevent hypertension. I'm in my early 30s with BPs around 120/70, but both parents have hypertension. This is Iggy from Tema. Quick spot response to that one, so that I move.
So lifestyle.
All right.
Yes.
In fact, that's the crux of
Somebody
is the
asked us to
foundation.
emphasize exercise and a few other things.
Yes.
Right.
I mean,
So the amount you need about 150 minutes of moderate intensity exercise.
Right.
By that I mean like 30 minutes of maybe walking, dancing, 5 days in a week.
Right.
That's it. Or if it's vigorous exercise, then about 15 minutes.
Okay.
So if you are swimming or you are cycling or jogging, about 15 minutes of that for about 5 days.
Right.
That's 75 minutes
Okay.
in a week.
All right.
It's fine.
So the three of us and Ziggy are going dancing. Okay.
Yes.
All right. Good afternoon, Mr. Nortey, and your lovely doctors. They never had lovely to me. I just want to commend you for the great work you're doing for humanity. God bless you and keep you going. Clenham from Greta Estate. Thank you, Clenham. Yes, only God. Dede, Maryland. You're late today. What's happening? Contemporary in its raw form, sauteed or cooked. I love Dede. Doesn't contemporary in our side of the world overcooked, or isn't it overcooked that all the nutrients are kaput anyway? So they want you to give us a recipe, or how should the contemporary be so that we don't lose the potassium?
So maybe you don't overcook it. Yes, that's it.
They don't joke. I have a call on the line. Let me read a few more quickly, Ziggy. Wow. Nortey, good afternoon. This is Kwesi from Kede. Rhymes. I usually take raw cocoa powder, which is very high in magnesium and potassium daily. My salt intake is very low. I'm about 43 years and my blood pressure is usually around 110/70. Can this also have an effect on my blood pressure? That is what he's taking.
Yes,
is he
in
on the right
fact,
track?
I did a research on that during my master's in anatomy, and I used natural cocoa powder in rats that have been rendered hypertensive to see what changes.
You gave the rats hypertension first, then you gave them cocoa powder.
Yes, I had to select a group of them
Oh,
and then gave them.
so what is the finding?
There was a significant reduction,
Okay.
about 5 to 10 millimeters of mercury, in the blood pressure.
Okay.
So that for those whose blood pressures are on the very mild level, optimizing lifestyle modifications with these magnesium and then antioxidant-rich foods is actually helpful in controlling the blood pressure.
Okay, someone shares here, bitter leaf also contains a lot of potassium. Ziggy, is my caller still on the line or have they gotten angry with me? Okay, let me take the caller and come back. Hello, good afternoon.
Yes, this is Chidiak. I asked a question related to some IA and some motivated promoting
Yes.
work.
We haven't lost it. Hang on. Don't go. Okay. He wants to bring in AI. And I know Chidiak, right? But this cleansing of, can we quickly just hit that? We're
Basically, the vessels are getting clogged because cholesterol plaques are building up. So you want to reverse that. It's targeted at lifestyle modification. And exercise is part of it, but the diet and certain things that you take are also part of all those cleansing systems that
Right.
you're talking about. So the vegetable-rich diets, the nuts and the legumes, and then the omega-3, garlic, and then the flavonoid-rich natural supplements
So the
are
dietary,
helpful.
right, prescriptions that are made, eat this, don't eat that, reduce this, and so on, they actually cleanse the system and keep it in good shape.
Yes.
Right. So when somebody advertises and, blast your ears and eyes online that detox, there's a 102-year-old woman, she's alive because she cleanses her blood vessels. This is exactly where I know Chidiak is going. What do you say to those kinds of is it advocacy, education? What do you say to that?
Well, every product that is unleashed out there must go through trials
Yeah.
and testing
Okay.
to validate their efficacy, their safety, and then long-term benefits.
Okay.
So, if there is a before and an after, objectively done,
Right.
and
Properly
then
researched.
yes, exactly,
Scientifically.
then it becomes acceptable.
Okay.
You will get your what called endorsement.
Right. Mami Efua in Tantra Hill asked a question trying to link her arthritis with BP. Can it elevate or drop your BP arthritis?
Now, when you come in with arthritis and your blood pressure is high, I don't focus on the blood pressure. I focus on minimizing your pain and discomfort from the arthritis.
Okay.
So I'll involve my colleague who is the orthopedic specialist, in that bringing the pain down to its minimum.
Okay.
Because pain complicates blood pressure.
Okay.
increase. Yes.
Great answer. Good afternoon, Nortey. Please, how do you have high blood pressure? How do you have HBP? Okay, I'm asking because anytime I visit the hospital and my BP is checked, I'm told it's fine. But like the doc said, it's a silent killer. I've lost my brother and a colleague just a few weeks ago due to that. Please, I really want to know. So, yeah, I mean, is it there? Is it not there? Is it dodging me? What is it?
So, like I mentioned, that you can actually have something we call masked hypertension.
Okay.
In hospital is fine. At home it may be high.
Okay.
And the way that we can know is by monitoring it at home. And I told you there are two ways.
Okay.
Either you monitor in the morning by yourself, or we give you the ambulatory BP
So we have to
machine.
catch it.
If you check it and
Right.
it's not there, then it's not there.
Okay.
You just make sure that you take your lifestyle modification or the habits seriously.
Okay,
and
let me
that's
just pin
it.
this way. This person is worried about family history, and then he's seeing people around him, right? They get it, then they are gone. So he's not too
So,
sure about this. 1 minute is
again-
there, it's wearing a mask, it's not. What do you do?
So, like I said, you do that, and then in our guidelines, there's also the part that when we say your BP is normal or non-elevated, it's below 120/70, but there's one to between 120 to 139. And then diastolics between 70 to 79.
Okay.
And that one we say you have elevated BP. Basically something like a pre-hypertension, but it's
Pre-hypertension.
called
We
elevated.
still have to do something about
Yes. So for that, we'll look at your risk factors. Like you, that you have a family history. We'll also look at other things. Do you have high blood cholesterol? Do you have all those things? And then there's a score system, like a score that we can
All
a risk score.
it. So you're,
based on
you're
that.
not just talking, you're actually looking at the
Yes.
indicators for this unique
Yes.
individual.
Yes.
Okay.
So based on the score that you would get, we would know whether to put you on again when you come and you are within that blood pressure reading. We also check as there's some organs that are being damaged. So we'll look at your heart. There's ECG that we can do. We can scan your heart to
Okay.
see. And then if there are some organ damage or subclinical organ damage,
Right.
we may have to put you on medication.
Okay, great. Good afternoon, Ultimate Health family. I'm enjoying this topic. Please, I would like to know what will happen for someone's BP to drop. Evergreen Linda Inosu. Linda, my darling, how are you?
Okay. So I mentioned that there are things. So dehydration, either from poor intake, so you are not hydrating well, you are not taking enough fluids, or you are having diarrhea, or you are vomiting excessively. Those are times, or you are taking some antihypertensive. Some of the medications for BP can actually also cause your BP to drop, or you've lost a lot of blood. Maybe menstruating, you lost a lot of blood.
Alright.
You've got a cut, you are losing a lot of blood.
Okay.
or even when you're anemic, sometimes it can
Okay.
make your BP drop.
All right.
pump
Hi, I'm
failure.
Dr.
Or pump failure, yes,
Alright.
from your heart.
Right. I'm Dr. Boedi Famdi. A little advice for the mechanism of action of medicines, pharmacokinetic and pharmacodynamics. I suggest you rope in the expertise of a pharmacist. Thank you, Dr. Boedi. And there's a reason why I asked them, yeah? But we'll get in that. It wasn't supposed to be a detailed pharmacological expose. Thank you so much. And I've got your number. I'll grab you one of these days. Wow, there's still stuff I haven't done. We've gone past 3. Ziggy, I'm just going to try and clear this one. What is the difference between, where is it? Iodine and traditional salt in relation to the increase or otherwise of hypertension? Seth, right? Iodated salt, then it'll be going around, your area. But he's bringing it up. Iodated salt, does it have a relationship? Quickly, we're out of time.
It's still salt.
It's still salt?
Yes.
Is it better salt?
Better in terms of other aspects. So maybe absorption of thyroid hormones and other things, yes.
For thyroid
For thyroid function, yes.
Yeah.
But
Okay.
it's still
But
salt.
you see, when it is excessive, then it becomes a problem.
All right. Okay, folks, we have so many questions. My producer Ziggy is looking at me. Ziggy, please check your BP and let me know. Right? He's looking at me, but we are over 3 p.m. I every week take away the questions and it informs my topic and whether I continue. Right? So if I haven't read your message or your question, please know that we have work to do. We'll see how best we can program that. We didn't get to talk about the full Monty of complications, stroke, eye damage, heart damage, and so on and so forth. So we will do that, right? But definitely we did not waste our time. Docs, yeah, the way you're breathing, Charlie, you are the cardiologist. When you breathe like that, I get worried. Can you wrap us up, Dr. Tobo?
Well, in its most simplest terms, blood pressure is essential in pushing blood around the body. But when it is too much, it damages the body.
Okay.
So, unfortunately, because it does that silently, we are all encouraged to know our numbers so that we can do something about it and prevent undue complications from hypertension.
All right. Great stuff. Nana Ekua and Dr. Benjamin Tobo. This has been a lot of work. Okay. I have a lot of reading up on the messages I've not been able to address. We will definitely get into stroke, the heart conditions and heart damage, heart attack, and all those things. We'll do that. Okay.
Yeah.
And I'm hoping I can count on you and other cardiologists and specialists in the field to do that. All right, folks, many thanks as always to my producer Ziggy Badio for giving me extra time. Though yesterday PSG didn't need extra time. In fact, Inter wanted to get out of there. Stick and stay on Joy 99.7 FM. Many arrears when it comes to hypertension. But know your numbers, speak to your doctors, and don't just be popping pills. All right? There's much more involved in keeping you alive and well. My name is Nortey by Nature. I'm out.